So this is Dr. Jaya. I'm with Kylee Vidrine, our partner pharmacist who teaches us and helps us with all the things regarding your compounding pharmacy needs, especially when it comes to Qsymia, as well as hormone replacement therapy bioidentically. So I am no longer a doctor, everyone, and I am now the patient. That's why I'm method acting with this robe, because normally I'd be dressed super professionally and like a doctor. Kylee, I've got this paperwork from ZRT Labs, and I was just wondering you could help me. I don't know what to fill out. I'm just so tired and I can't lose this weight, and I'm so frustrated. It's so hard being a woman.
It is. I feel you, girl. And it seemed a little overwhelming when you open this box and there's all these papers, but it's actually really simple, and it's only 2 papers to fill out. Everything else is just fluff. So I'm going to go through it with you real quick. So on your test requisition paper, it looks like this. You're going to fill out number 1, which is the typical information, your first name, last name, date of birth, all that. Number 2 section is just asking about your menstrual status, if you have regular, irregular, or no menstrual cycles. And it's very important for you to indicate if you've had a hysterectomy and if you still contain ovaries or not. That is very important to document on there. Section 3 is symptoms. You're only going to fill out the section for women, obviously. Fill it out to your most ability to be the most specific. Go all in right here. Be very honest, brutally honest with yourself so that we can help treat you the best. On the back of the paper, number 4 talks about your current hormone and medication use. This is very important to fill out accurately if you're currently on any prescription or compounded hormone treatment. Also, other medications that are not hormones, because sometimes those medications can interact with hormones. So we need to know all of that information. Number 5.
Any prescription medication that I'm on, I list, whether I think it's relevant to hormones or not.
Correct.
Okay, gotcha.
Because they will decide if it is or not, the lab. Number 5 is going to be the date you collect your saliva. So that's important that if you are not menstruating, you can collect on any day of the cycle. It doesn't matter. If you are currently having a cycle, you want to collect on day 19, 20, or 21. Day 1, of course, is considered the first day of your period. So you want to collect on day 19, 20, or 21. If you are irregular, you want to pick the day that you think your period would start. Choose 5 days before that.
Oh, okay. Okay. Just kind of like your best guess.
Yes.
Okay. And then if you're in menopause or you haven't had a cycle for years, you can just do any day.
Correct.
Okay.
And then you're going to write the day. And then most women just need to do saliva profile 2, or men or women, saliva profile 2, which is $155. And you only collect twice. So you collect in the morning and at night. And so in the morning, it'll be right as you wake up. So you wake up that night before, go ahead and put your test tube on your nightstand, wake up and start spitting until you fill up half of the tube.
So don't brush your teeth or anything.
No.
Wake up and collect your saliva.
That is correct.
Okay.
And then at night, you're going to want to make sure you separate your dinner from your saliva collection 2 hours. So, for example, if you eat dinner at 6 o'clock, then by 8 o'clock, you're good to start spitting in your tube. And then after you spit in your tube, make sure that's when you brush your teeth. Do not brush your teeth before you start spitting.
Okay. So either morning or evening. Gotcha. I really don't brush my teeth at night. Is that gross?
I mean,
I'm too tired. I'm like, whatever. I'm going to have to do it in the morning.
On number 6, you're going to select the saliva profile 2. You just fill in that little bubble. You know, it's just like taking a test, but easier. Number 7, you'll select your payment method. Most people pay ZRT with a credit card. If you're still old school and write checks, that's all you, but
they're going to judge you for doing it.
So if you do a credit card, in your saliva kit, there is a credit card authorization form that looks like this.
Okay.
And you're going to fill this out with all your credit card information. So that's what that paper's for. And then you'll sign on number 8 that you're over 18 And you'll fold up your little paper nice and tight, and you will put it back in your saliva kit with your credit card authorization form and your saliva. Stick it all back into the container like this. Put it in a envelope with your prepaid label on the outside. It's important that you don't have to keep your saliva refrigerated. If you spit in it, you can just put it back in the box and leave it on your kitchen counter, and you need to bring it to a UPS store. I would send it out on a Monday. Also, just to go over the directions on how to collect your saliva once more, because it's very important that it's accurate, since we'll be making dose adjustments off of these numbers. Like I mentioned before, if you are you menopausal and not having periods anymore or had a hysterectomy, you can collect any day of the month. If you have regular cycles, you're going to collect on day 19, 20, or 21. If you have irregular cycles, you're going to collect on when you think your period is going to start 5 days before that. Also, if you are currently already using hormones, you're just going to stop them 12 hours before you use the saliva. So basically what that means, as an example, is if you take your morning dose of hormones, then you can start your saliva collection that night. Just make sure there's a 12-hour gap.
So the morning and evening saliva collections don't have to be the same day?
No, they don't. Mm-mm.
Oh, okay. Okay.
Yeah. And then if you're on a once-a-week patch, you just collect your saliva 3 days after a once-a-week patch.
So you're still putting it on. You're just doing it 3 days after you put a new one on. Okay. Okay. So, okay, gotcha.
If you use pellets, you just collect midway through your pellets. So 45 days, because they're 90-day pellets. And then if you get a once a month injection, you just collect 2 weeks after your injection. So basically just the middle.
So you're not really stopping any kind of, because like I'm going to do it this period cycle. And I've had some hormone replacement therapy that I've been intermittently compliant with. So I'm like, well, I'm just going to stay off so I can get the cleanest numbers.
Yeah.
So you don't have to do that.
No.
Okay.
And then you're going to want to avoid anti-aging, anti-wrinkle facial creams for 3 days prior to testing, because sometimes they can have undisclosed hormones in them, small trace amounts. Do not eat, drink, except a little bit of water, or brush your teeth prior to your collection. And like I said, you're going to want to spit till you're halfway through the tube. And some tips to help you increase your saliva production is smell food, particularly for me, bacon. Bacon helps me salivate.
Yeah, I was going to say pizza, but bacon's a good one. Yeah.
Yeah. I mean, usually bacon's in the morning, but pizza's at night. Yawning, pressing the tip of your tongue against your teeth. Those are some things to help you increase saliva, because some people have a hard time just like salivating on command.
Yeah.
So
there's a joke there somewhere, but I'm not going to make it.
You write your name on the test tube. And like I said, you put it all in a container and send it off and let the magic happen, and let the Shed It Clinic and Dr. Jaya and Megan get you all fixed up.
They will charge your card if you put your credit card information, like as soon as they receive the sample and process it. And then the results will be sent to the provider. And at that point, like in this case, you're my provider. So whenever you get my results, you'll contact me and schedule a consultation, and then we'll go over the results. And then based on that, I can then get exactly what I need through Boudreaux's new drug in Lake Charles, because y'all do the compounding there.
Yes, we personalize it. You get a customized dose just for you and your body, because we're able to make the doses specifically for you. And so your body reacts to it the way it should, with the least amount of side effects.
That's the dream. Okay. Thank you, Kylee.
You're welcome.